The question is about the role of talk therapy or psychotherapy and medication in the treatment of depression. And part of that is I'm going to come back to the notion of severity. If you have a severe depression where you're having trouble concentrating, motivation is very low, your energy is minimal, you're not able to enjoy anything because your reward circuits are just kind of fritzed out, if you want to put it that way. If you have that kind of a depression, I can talk to you in any kind of way. I want to talk to you all day long, all week long, all decade long, and it's not going to necessarily make you budge. Where I think the mistake is in assuming that somebody that has the milder form of depression necessarily needs medication. Okay? The person with the severe depression, there's no question that a person with severe depression needs to have medication. And you need to be able to get to a point where you can really benefit from the psychotherapy cognitively before you can really start using that to change your behavior, your responses that really involve responding to the psychotherapy. There are some things that unfortunately people do that interfere with change. In my opinion, one of the key features of change is anxiety. If you're not anxious, I can't make you change, right? There's a curve. Now, if you're too anxious, I can't make you change. So there's a fine line. Now, what unfortunately some folks do is they over-rely on alcohol and drugs like Klonopin and Xanax to manage their anxiety, which really would be informing their psychotherapy. And so I think, my own personal opinion is that some of those drugs interfere with the person's capacity to change. And so, you got to pick a horse. If you're gonna do psychotherapy, then you need to not get in the way of the psychotherapy. But that's just me. I'm a heretic when it comes to that sort of thing. So.